Dan, good morning, Dan.
Morning.
What's your situation, Dan?
Hello. I'm a bit concerned about a couple of weeks ago. My dad died.
So your father passed away, and since then you recognise some of the symptoms that we were talking about this morning.
That's right.
Yeah. What sort of things?
The lack of sleep, feeling grumpy, upset, tearful at a drop of a hat. I can be in tears. Just feeling generally down and tired.
Yeah. Well, it sounds exactly like the symptoms we were talking about this morning.
Yeah, well, I mean, Dan, look, your circumstances, you know, you've lost your dad, so there's bereavement there, which is a common cause of depression. Just quickly, the other causes of depression, 15% of cases, there's a family history of depression. For women, if you've had premenstrual syndrome, you're at increased risk. Postnatal depression, increased risk. So, you know, there are factors that may make you more sort of susceptible to the condition. And the hard thing, Dan, is, I mean, you've got the symptoms, you heard them this morning, you identify with those, so this means, you know, you may well have clinical depression, and, you know, you really, it's not just you coping with this. People will say, pull yourself together, you know. You can't. I mean, if it was that easy, you'd put yourself right, and you're not coping, and it's very hard for anyone, especially a man, right, to admit they've got clinical depression. I know, I've been there. You know, if you had, say, broken your leg and you were off work for 2 months with a fractured leg, that's fine, everyone's okay. If you're off work for 2 months with depression, it's not okay. This is the stigma, the lack of understanding towards depression. So, Dan, my advice to you is, look, you've got to accept that you may have this condition, and I think you must go and see your GP. When you have these symptoms, you've got to tell somebody, especially your GP, because help is out there. If you have to take antidepressants, that's not a sign of weakness. Antidepressants work. If you take the medication, you will get better.
Dan, how does that advice seem to you? I mean, are you happy to go to your doctor? Is it something you feel comfortable talking about?
I was talking to one of your researchers, and it's kind of highlighted now that I do need to go speak to somebody and get some sort of help somehow.
Yeah, well, if this is step one, that's great.
Dan, it's very difficult. I fully understand, but look, your GP is seeing this all the time. Look, you're not alone. There are as many people suffering from depression as have cancer out there, so you're not alone. Go and see your GP, be wide open with them, tell them exactly your symptoms, and you'll get help.
Good luck with that, Dan, and sorry for the loss of your father as well. Take care of yourself. We've got Nicola on the line now. Good morning to you, Nicola.
Hi.
Now, you're 26 years old, aren't you? And you've been suffering with depression since you were 17, so an awfully long time.
Yeah.
So you've been able to keep it sort of subsided for a little while, but in the last 18 months it seems to have come back again.
Yeah, the anxiety's just sort of taken over, really. I'm always fearful that people around me are going to die. It's actually sort of made it difficult for my relationship because my partner can't leave the house without me worrying that he's not going to come back, and then it's just a natural worry for me.
Really debilitating.
Yeah. So, well, Nicola, let me ask you some questions. You say you had depression when you were 17. Were you given medication then?
Yeah, I was, and it did help, but then I sort of fell into the security of it. I felt better, so I stopped taking it.
Right, so how long were you on the medication for?
About 2 years.
All right, okay, so you stopped taking it. So you've been without any medication all that time?
Yeah, I was re-prescribed it, but then I just feel like it's the stigma attached to taking medication. I just wonder why I can't just be happy without it, and why I can't just feel normal without it.
Okay,
this is a serious problem, isn't it? This,
straight away, this is the frustration of depression. Look, if you had a hormone problem due to low hormones, you'd be given hormone therapy to take those levels up to normal, to help you to feel normal. With depression, something has caused the chemicals in your brain to be drained down. And with antidepressants, they help these chemicals to come back up to normal, to put you on an even keel. Now, you know, your symptoms are not sort of obvious depression symptoms. You've got anxiety, you're paranoid about people going to die around you, anxiety, but also you do actually admit that you're starting to drink more alcohol.
Yeah, I mean, I wouldn't say I don't get up and have a drink or anything, but I just tend to find like I would rather just sit up and have a drink and rather than go to bed because of the paranoia of just feeling like I'm worried something's going to happen.
Yeah, well, listen, I mean, again, look, you need to go and talk to your GP about this, but I'm just concerned about alcohol. You see, when you take alcohol initially, you know, it lifts your mood, your inhibitions go, you're feeling great, but then alcohol is a depressant. It is a depressant drug
So
on
you're
the
in a
brain.
kind of vicious circle once you start.
Yeah, and anyone with depression should not have alcohol in their life. It is a depressing drug. You don't think so when you're having a few drinks in the pub or with friends, because, whoa, hey, this is great, but then anymore it's starting to depress your brain, and I think you've got to try and get the alcohol out of the way, talk to your GP. You've had depression before, which puts you at a slightly increased risk of it occurring again. Do you have any problem with premenstrual syndrome, premenstrual tension?
Yeah, I do. I tend to find at that time I'm a lot more angry and upset.
Yeah, and do you get mood swings?
Yeah.
Yeah, they're predisposing factors to depression.
Nicola, your biggest thing to take away from today is there is no shame in taking the antidepressants and getting your medication right at all. So you need to stop thinking like that from right now, okay?
Okay.
All right,
Yeah,
good luck.
look, I took mine for several years. You put on long-term medication when you've had more than one severe depressive episode over a period of 5 years. So you take long-term medication. Hey, gets you right, gets you back to normal.
Why wouldn't you?